A very warm welcome to our hospital. I'm Sherwood McCassie. As always, I'm pleased that you have joined us. The Pediatric Intensive Care and the Neonatal Intensive Care units here at our hospital play a crucial and life-saving role in our hospital healthcare system as they provide critical care to infants who are seriously ill or injured and to our children. It is therefore important that the ideal nurse is chosen to work in this department. Speaking of nurses for this unit, they derived a great sense of satisfaction reporting for duty and assuming their various roles here daily at our hospital. Now, this segment is led by Jessica Gibson, a registered nurse in the Neonatal Intensive Care unit. She makes it abundantly clear.
I love babies. People will come and say, how long were you there? I'll be like 12 years. They'll be like, you aren't going nowhere? I'll be like, nope. Because I have developed that passion. You get attached. There are cases that you will remember. And throughout this process is like a joy in seeing the babies grow. And I would say NSU have taught me patience, because when I have a premature baby, one that's less than 2 pounds plus, I just can't wait to actually see them grow. I just can't wait till they put on their little fats. They all come with their different attitudes as young as they are. So it has taught me patience, right? And yes, I can say I love NICU.
I always wanted to be in pediatrics. So when I finished my program at Barbados Community College, pediatrics was my love. And I ventured out into that. It took me outside of Barbados, but I was able then to see a bigger scope, conditions that, you know, I only read in books here. Then appreciating what we have here versus what was over there, and then coming back and trying to make it better for Barbados was one of my big things. Nursing is ever-changing, so it's ongoing learning, and I try to share what I've learned as well with my colleagues and other students. So it is important because these are our future, and you know, every child does not have the same script. Every family does not have the same script. So every child that goes to school does not have the same script. Some are battling with diabetes, some are battling with hypertension, some are battling with kidney problems. But they're not going to wear that shirt, that t-shirt with that on it, or they're not going to carry a placard. So it's like life behind their life, and trying to support them the best way they know how. We can't keep them hospitalized. We have to teach them how to live with this condition in their outside world. So pediatric unit and pediatrics is important because we are basically planning and keeping the future as we live. You know, a sick child can be the next prime minister. We don't know. There are a lot of adults with issues and with medical conditions, but no one knows unless you're close. So we can make that child, give that child a better life, give that child a better chance at becoming an adult, at becoming a young adult, you know. So we are the baseline for adulting, basically.
Oh, how I got into nursing? Well, I always love caring for people. So I believe that when I first started nursing, I said, I can't do this because, you know, it's someone's life that you're taking care of. And if you do the wrong thing, you know what can happen. So when I first got into it, it was, I lived in the US for a while. And first I did home health aid. So I loved it. I loved learning about the different conditions and how to deal with all kind of aspects of care. But it wasn't enough, so I felt that I needed to go back to school and learn more about nursing and how to develop further. So I actually came back to Barbados. I went to Barbados Community College and I did nursing there. And then I started here at QEH and I joined the pediatrics department in 2014. So I love children. So I was happy to be in that department, and I was very surprised because there were so many different conditions. Okay, in the department as a ICU nurse, we have lots of critically ill children. So there are children that are at the stage where they can't be on the pediatric ward, so they have to come into PICU. So basically they can be intubated, they can be in severe respiratory distress, they can be unconscious, so you can't, sometimes they can't say what is wrong. So we have to basically attach them to cardiac monitoring, get possibly a ventilator in place, and try to find out what exactly is going on. So basically we're running labs constantly, trying to see if this child is at a point where they're getting better, are they getting worse. So it's a very crucial and intense area. Yeah. The PICU was open in 1977. So I think being that it was open here in Barbados and we have many people coming from different islands to have care in Barbados, I think that is so important, because imagine someplace like Antigua that had issues and needed someplace like an ICU for children. And you saw what happened in Guyana with the burns, because we have children under burns here also in Barbados.
We have had admissions from the likes of St. Vincent, St. Lucia, for medical care. Sometimes it could be severe head trauma, oncology children we've catered to. Or maybe they have to have a special surgery that our doctors here can provide. So we have catered to, and we are catering to those countries as well.
So all of that, like cleft palate, all those things that we see in the ICU, for Barbados to have an ICU, even though it is a small ICU, I think it's so important, because the care, so imagine someone had an MVE and you don't have anywhere to have your child intubated. You have no nurses that know how to deal with children. You have no nurses that know how to deal with that illness and at the level of a child. So I believe that is the best thing. The PICU is very important in Barbados and critical.
And we find comfort in the knowledge that such a unit exists here in our hospital. Its services are of paramount importance. Now, speaking of services, there is specialized care, advanced medical technology, a multidisciplinary approach, and a family-centered focus that contribute to saving lives, improving patients' outcomes, and advancing the field of pediatric critical care. It is an essential component of comprehensive healthcare services for children and adolescents, offering hope, healing, and support during times of medical care.
I think a lot of Barbadians do not know we exist. And those that know we exist probably are not aware of what we are capable of doing. You would hear a parent, oh, I have to take my child to the hospital. Oh, it was in hospital. But that's just blanket. But when you come to the pediatric ward, our aim is not a hotel, but to make your stay as comfortable as possible as we can, making you making the parent as comfortable dealing or taking charge of giving care.
In the ICU, we have we start off with the report, because you have to know what is happening with the child. So basically, sometimes we don't have patients, so we have to monitor the unit. The unit is basically a 4-bedded unit that we have here in Barbados. So we have to see basically what is there, like, do we have all of our supplies? Do we have all of our resources? Number one, we have to make sure all of the things are on the wall suction. You have to make sure you have your oxygen. You have to make sure that the tray for each patient has their own supplies at the bedside. So each area has, say for example, you have a child coming in now. You have to know how old that child is. So because each child is different and you have different sizes for each child. So for example, the laryngoscope will be a different size for a smaller child than an older child. You have different face masks for the younger children. You have different ventilation mask bag for the other child. So all of them small, medium, large. Just like a blood pressure cuff, we have the different sizes. We have different probes for the fingers. You have to make sure you have all of that. So when you have the setup done, then you have to make sure that that bed is the correct size. We actually move a lot in pediatrics. We're moving beds. So you have to have a cot for a baby. You have to have the big bed for the bigger child. So it is basically you're setting up based on age. Then you have to make sure the weight, you have the weight, because our medications are based on weight in pediatrics. Without the weight, you can't have the correct care. So you need to have that in place. Then after that, we are monitoring you on the cardiac monitor. We have a flow sheet, which is very big. So we have all of the various information on that flow sheet. We're monitoring. We get excited over little things like a child breathing. You know, breathing is so important, isn't it? Yeah, we get excited over them urinating. We get excited over that, over them just taking in fluids that they're actually drinking, because sometimes they're that ill. We have critically ill children that can't do things on their own. So you could understand a child attached to cardiac monitoring. They have all of these things attached to them. Sometimes they say they're little robots, right? They have all these wires on them. They have, so you know, it's hard on the parents for that. So basically, through the day is basic monitoring, making sure that the parents are well and that they understand what is happening with their child, what the procedures are, and hope that they don't get, you know, think that it's going to be worse than it is. So it's trying to reassure them, and also making sure that the child is getting better. That's our hope. So we work towards that goal constantly.
So we would come in, we get what we call handover. So from the previous shift, we are allocated our patients, and regardless of how many there are, we cater to the medical aspect of the child. So disputing the reason the child is there. It could be from a new diagnosis to an ongoing diagnosis, and we have to give care. And we also have to give and cater to the family. So as you can appreciate, a sick child in any family, no matter how big the family is a stress. So especially if it's a new diagnosis. So we're teaching the parent, teaching the family, because sometimes it's just not mom or dad, or mom and dad, it is grandparent, it is auntie. So teaching the entire family unit of what is new, what has to be done, and discharge planning as well. So we know that little baby Johnny is to be discharged in 2 days. So we prepare them for life at home with this new diagnosis, or for life at home, but with a changed way of facing the diagnosis that they would have come in with. So we build relationships, It's a multidisciplinary approach, so it's just not nursing. We can bring in the speech therapists, we can bring in doctors, as you can appreciate, we can bring in social worker. So it's working in a team to make the life of this child and the family a whole lot better when they return home.
Some just recurrent antibiotics. We can have conditions such as group B strep, any cardiac condition. We have some PPH, and those babies are normally very ill, so they will require ventilation. Prems, as I said, prems take up the majority. So with the prems, we have to take them because they are so small, as I say, 2 pounds or less. So we have to assist with their ventilation, their nutritional needs, and we basically bring them up to 3+ pounds. And as I said, that can take sometimes up to 4 months. So during that process, that includes a lot of patient teaching to the family, to the mothers. We have to assist with breastfeeding, teaching how to sterilize, teaching how to change a pamper. Kangaroo care is very important. That assists with the growth of these extreme prems. It assists with settling the respirations, maintaining the temperature, settling the heart rate. It assists them in growing. So kangaroo care is when we basically put the baby naked, chest to chest with mommy or daddy, and they hold them as long as they can. It can be up to a few hours per day, right? So that assists greatly with getting the baby there. Apart from teaching, sometimes you have to offer emotional support, because NICU in itself is a very taxing place. If you have never been there, it can be very intimidating. And I always say the first day I walked through those doors, I was scared as a nurse, and I was asking myself, Jessica, this is what you want to do, but yeah, so for me as a nurse, it was intimidating. I can imagine the parents. So sometimes you have different emotions along the stay coming through. So we have to meet psychological needs, emotional needs.
It's an extension to the extended family. Yeah, and that's how we try to make it, because even though you're in hospital, you're sick, you're learning something new. Hey, you know what? There's a better way to learn it. Hey, you know what? We are here for you to take you along this journey, you know. And if you have any questions, we have an open policy. You just call the ward and somebody would give you the information. So we try to make it home away from home as best as possible.
And in so doing, the unit has recognized the importance of allowing family members to be in touch with their little ones here in the unit. And more importantly, it allows them to create that home-like atmosphere that is conducive for the recuperation of the child. Like every establishment, there are rules and regulations set up for the benefit of all. The process of following best practices ensures the highest standard of care and the best possible outcomes for critically ill children. These best practices are evidence-based guidelines and protocols that have been proven effective through research and clinical experiences.
Listen to our nurses. Sometimes it's a challenge. Yes, we know your child or ward is ill and this is a stress. Do not take it out on us. We are here to assist. There are rules to follow by. We don't make them. They're the policy and protocol of the hospital, and sometimes we are treated as though we are the ones making the rules. Adhere to each nurse, because or everybody that comes into their contact. We all know what we are doing. We are trained to do what we are doing. So try not to second guess us, and especially go to Dr. Google. And that's, I would say that's probably basically it. Because we allow parents and guardians to stay with the child. the child is underage, so he by right or she by right can't say no, I don't want to do that or whatever. So it needs a guardian there. We allow that to happen, but don't abuse it by bringing the entire neighborhood because we still protect our children against COVID. And a lot of our visitors don't seem to want to appreciate that. If we protect our children, we have to set boundaries for who's coming to visit, whether or not it is the brother, whether or not, you know. So, and another thing too was the rules of the hospital is under 12 are not supposed to be here visiting. We get a lot of backlash about that as well. So just to adhere basically to what is written.
I think the parents can, they say that they enjoy the nurses and the work that we do. Sometimes they don't understand our work and they believe that, you know, they just want to get home. And that is our goal. We want them to get home too. So I try as much as possible to let them know we have the same goal. We want your child to be healthy. We want your child to be strong. We want your child to be able to function and learn and to the best ability that they can, the highest potential. So I think that the parents appreciate it more when they see their child is now able to do what they were able to do before, and they can go forward and be productive. But I think that they have to get some more education, which is everyone needs education. I think it's very important to be informed and to know that we're here and we all have the same goal, which is to have a healthy Barbados.
Well, the power of accurate and reliable information when applied. Now, if we were to combine that with the same objective, we would achieve the same goal. Now, with a committed and dedicated staff, the pediatric and neonatal intensive care units here at our hospital are prepared to help and do their best in ensuring that our infants are healthy through the provision of the best possible health care. I'm Sherwood McCaskey. This has been Our Hospital. The series continues next week at the same time.